do you see BRICS countries addressing challenges of health system resilience, and what areas of collaboration kind of stand out for you?
Well, we have first to classify the health issue, because BRICS is not reinventing the wheel. BRICS has got two preoccupations. First, within the health, is like in the economy. Preoccupation of BRICS is that member states are not left at the periphery on benefiting from health systems that already exist in the world. We cannot, as BRICS member states, exclude ourselves from the World Health Organization, for example. But the question is how to establish just access to the products of these systems. In other words, we can say, how do BRICS member states or BRICS member countries are able to access health public goods in the similar manner that are accessed by developed countries and some developing countries to that fact. So BRICS has got two duties here. One is to see to it that its member states and the entire global south, if we go according to this year's summit's theme, the entire global south has access to health products, number one. But number two, BRICS is preoccupied that do we have systems in place in these member states and the global south that will help, because we cannot train BRICS shouldn't be seen as, or its global south member states to be seen as draining the resources of systems that are already built. So there must be systems in place in South Africa that are parallel or congruent to existing health systems in the world. Those are the two. Just access. What do you have as a foundation within your own nation state that will then act as an impetus for you to have that access? I think here BRICS plays that bridge. It straddles between the international and the national, but within the ambit of the BRICS configuration. Now, let me split it for you a little bit. There are two things that are important here that we have to adhere to when we speak of health. As I said, that BRICS does not need to reinvent the wheels. We still have to go to the Sustainable Development Goal number 3. Health falls under that, and that Sustainable Development Goal number 3, that SDG, points of universal access to health, universal access to health products. So universal access to these public goods within the framework of health. So BRICS has split, categorized it and put its case toward using 9 points. The first one is cooperation on the field of nuclear medicine. The field of nuclear medicine is vast. But then BRICS says, look, in the global south, we seem to lack in the human development in order to address this issue of nuclear medicine. So BRICS seeks cooperation amongst BRICS member states, amongst the global south, and among those existing structures elsewhere in the developed world. The second one is the integrated early warning systems. Because even during COVID, what saved many lives, which were early warning systems. Of course, we had an eclectic format. China had its own format of detection. The United States of America had its own format of detection. The Russians had its own format. We had our own formats to a certain, even in some cases, we're using our own traditional medicine and our own local means of this thing in early detection. So BRICS is trying to integrate all of those together. The third point is the MOU BRICS regulatory agencies on cooperation in the field of health products regulation. You remember during COVID as well, we had Madagascar with its own medicine, we had Tanzania with its own programs in medicine, we had Russia with its own vaccine, we had China with its vaccine, and you had an array of vaccines from the developed world, which was focused mainly to Western nations. So BRICS has already drawn an MOU for BRICS, intra-BRICS member states, for the Global South, but primarily with those who are already leading in the field, so that not only medicine from a particular nation should override other medicines just for profit's sake. Because once that happens, then we're excluding some members of the globe. We're excluding either Global South, or we're excluding people in terms of their income. The next one is the establishment of the BRICS Health Journal. Another one is the BRICS Medical Association formation. Now, number 6 is very interesting, because as different pathogens come up and different viruses come up, we have what we call antimicrobial medical association. We find that there are some microbes that are more resistant than others. But how do we know that when we don't have a general database? We might have it in the developed world, but is there a way of integrating those within the Global South? That's a preoccupation of BRICS. And then BRICS Research Network, which speaks the same thing, that do all these medical institutes that exist within the Global South, are they coordinated in some way? Do they form one network? Because if those things happen that I've just mentioned now, then we're at a level of a well-integrated health system, not only for the Global South, which might even help the already fixed this thing of the Global North. Remember that BRICS population is 43% of the global population now. Another one before we talk about the last one is BRICS Vaccine R&D, which we have a center in Ethiopia for the African case. And the last one, it is still networking all of these points together. So we're still talking about 2 things: access and coordination. Access and coordination. There is no health system to beat another health system, no. Is how do you establish a justified, a just way of distributing these health products to everyone.
Okay. So does BRICS have the capacity to kind of level the playground a bit? Or can they?
At this point in time, remember, BRICS is a new kid in the block in terms of implementation.
Yeah.
And the focus has been exactly on that, on capacity. That's why the focus of BRICS, although it was cooperation all over the entire structure, the focus has been on establishing financial means. That's why we have the BRICS Bank, you have the branches of BRICS Bank, you've got CRA, you've got all these projects. That is to establish that formidable force. That's number 1. Having said that, I think a practical implementation within health at this point in time, the focus is on global pandemics, on pathogens that keep changing. We have mpox, for example, now. That is a global issue, because even in this ministers' press summit gathering, one thing that they point is that viruses and pandemics and all these mutating pathogens have shown that they don't respect international borders. So I think BRICS is at that level, because if you take a scenario or take examples from COVID pandemic, one thing we've learned is that even that divide you speak about in terms of South Africa, that divide was wiped away. Actually, to a certain extent, those so-called private hospitals, they did worse than public hospitals for some reason, I don't know why. But there's another thing we have to strengthen. BRICS is not taking over responsibility of national governments. That's why I said one of the preoccupations of BRICS is, as we have these goods internationally that are supposed to manifest in a just distribution of health goods, BRICS also is preoccupied if there are foundations in these nation states, in their member states, and the global South member states, in order to access. There is one thing to access because you are not giving access from the center, but also there's another thing not to have access because your systems are weak. And this is what you're mentioning. So the onus are on the member states themselves if they're adhering to the call of BRICS. It's no longer the BRICS issue. And it's definitely not only the issues of resources when we have pandemics. Once we have pandemics, we saw a stream of distribution that even bled out those so-called first-class citizens with access because of money and the grassroots people who use public hospitals. That was wiped out. When there's a pandemic and when there's a crisis, those lines are bled because everyone needs to have access. Those things, they become a national issue.
Okay.
To answer your question directly, yes, BRICS, in terms of its mandate and responsibility, they have resources to be able to roll out the health system that they propose.
Okay. All right. I think finally, how does the BRICS health agenda kind of influence the global health governance?
The motto of BRICS, or the mantra, has been just access and cooperation. Speaking from humanity perspective, it means we're going to have less victims. Global South is no longer a burden of the Global North, both in good ways whereby the Global North can remain with its resources because we have another resource that will take care of those that were left outside the cycle of accessing public goods by design. So BRICS is addressing the old elephant in the room. That is the first one. That's how BRICS is influencing the global health system. BRICS wants to have a say within organizations like WHO, within subsidiaries of the WHO like the IPN. BRICS want to be in those spaces in order to, actually, BRICS is taking away the burden or the guilt of the global north, if we were to say so. So it's influencing also, because when we speak of humanity and we speak of statistics and we speak of death rate and we speak of birth rate, those things are related to GDP as well.
Yeah.
First, it stabilizes, ironically, it stabilizes the GDP of the global north because we no longer go and beg them. But at the same time, it is addressing issues of mortality rate and birth rate within the global south. But that they've already done also by seeing to it and making efforts to up the GDP of the global south. And if you up the GDP, mortality rate is low. And if you put then infuse direct factors that will prevent that mortality rate, you're upping the GDP. There's a symbiotic relationship between the growth of GDP and mortality rate, the growth of GDP and the birth rate. But we are taking away the burden from the so-called solidarity train or aid train. So it influences because it means we who are 60 today, the 60s of the next generation can live until 90 for sure, because we have those systems in place. We are a generation that were born during the time when we were excluded by design. But BRICS is adding to the, yesterday I spoke about 50 years of post-colonial global South. That was 50 years. But it's after that half a century that we're now having the implementation of the tools of post-colonialism. And BRICS emerges as a result of that. And if you look at tools that were chosen, at countries that were chosen because of their numbers of growth in terms of the GDP by Jim Neal, you can see the correlation there. China had a super boom in terms of its population. And that population is the population that sort of acted as a buffer as China was growing. So the growth of the dragons, of the 5 dragons, is within that ambit of the demographic bulge, or what we call a higher demographic, or what we can call the youth demographic dividend of the world. So yes, BRICS is doing a good job there because it's closing a big gap, and that gap was contested because even with growth of the GDP, with growth of your economy, if you don't have systems, if you don't have health systems in place, that GDP growth is going to dwindle like yesterday. So these things are correlated to one another. So as I said, there is a mutual symbolism between the aspect of GDP growth and the aspect of access to health. This thing. Thus, from the first Sustainable Development Goal, which is the eradication of poverty, that is related to the GDP directly. The third one is the access to health goods. That's how closer they are, the GDP growth and access to health products. Thank you, Bob.